tale of frustrations by insurance companies. And of course, whereas one might say that this is no excuse for them to do that, the question would be, what gives them the right and the authority to do that, to overcharge and give unnecessary tests? So James Mamboleo, again, a profession just like lawyers, which is expected to be above board to ensure that they keep the sanctity and dignity of people in terms of health. But if this story is anything to go by, they're frustrated by insurance companies, and as a result are trying to make money from other ends.
Michael, in the medical services industry is a place you would find some of the most overt and extremely sophisticated forms of corruption. I can tell you today that most doctors feel extremely happy to tell their patients to conduct all manner of tests every time they visit a hospital. Even if I went to hospital today and I am not suffering from anything serious, probably a flu here and there, you'll see the doctor telling me, you see, James, you need to carry out a number of tests to just make sure that the problem you think is the problem is actually not the problem. And I really, really feel for it, especially when it is for or about young children. You have an infant 2 years old or 3 years old, and they have to take samples of blood from them for purposes of carrying out totally unnecessary tests. So, two things. One, the fact that doctors in the first place would do that even when they do not need to carry out those tests is extremely appalling. And then secondly, every time, especially if you are an insurance covered patient, every time you look at the bill that comes out of every visit to hospital, you will get extremely surprised. The upshot of this is that especially employers who are required to provide medical insurance to their staff find it extremely expensive because the premiums have to go very high. So what we want to see is a situation in which somebody has to regulate that sector. Even in the lawyer's profession, there is a law that says this is the amount of money you can charge, at least as a minimum, so that clients know that if the lawyer says that they want more than that, I can actually negotiate. But for hospitals, you have absolutely no way. You can negotiate. So we expect that in a country in which, for instance, the government is trying to come up with universal health care so as to respond to the high costs of medical services, we expect that institutions that offer medical services, but those people exactly who have taken the Hippocratic oath, the doctors, they will be assisting us in rolling out services that are affordable to wananchi on a day-to-day basis.
On a day-to-day basis. All right, and allow me now to introduce our third guest who is joining us, Steve Ogutu, who is a governance expert. Thank you for joining us. And maybe just to bring you in, there's also a story on page 13 of the Standard, which is to do with matters health again. And this is the looming nurses strike, which they have threatened in, I think it's in 11 counties. It's expected to kick off today, of course. And their complaint is that the return to work formula that was agreed upon has not been honored by the counties. Again, Mwananchi is left suffering at the hands of these two bulls fighting, the county and the nurses.
Thanks for having me, Mike. I think it's a very sad affair. I mean, first and foremost, I don't really understand why this health function had to be devolved into the county functions, to be a county function rather. Because it's like the counties don't have that capacity to handle some of these needs that are being raised. What would make them not able to handle? Management? For instance, of course, poor management, and of course there are issues of, the HR component of it was devolved from the national level to the county level, the pays and stuff like that. So I think that there is there should be a serious concern, other response from the government, and see how best we can get to handle this, because health is a very serious issue in a country. It affects millions of Kenyans, nearly all Kenyans, and so we should not be having politics around it. And I think the nurses and the counties had a CBA just the other day. And out of the 47 counties, less than 10 have complied to that CBA, you know. And you wonder where the priority is.
Where the priority is.
Yeah.
All right, and let me come to you, Senator Irungu Kangata. One might argue and say, well, it's too late, we've already devolved health, and as a result, the counties should be able or equipped to deal with it. Do you feel that maybe it was a mistake to devolve health?
Well, yes and no. Let me start with the no part. That you have to take into account that there are several other functions which have not been devolved, but people still continue striking. Let's say like teaching. We always hear NAT causing strikes day in, day out. So therefore, I think the fact that nurses are striking, to me, I'm not so sure it has something to do with the fact they're being devolved. However, yes, to the extent I also know that there are several counties that have mismanaged their health sectors. You find the small clinics in the rural, in the village areas, they don't have enough personnel, they don't have medicine. You find some governors, instead of buying from KEMSA, they are now buying from private individuals, so therefore they enrich some few individuals to the detriment of the majority. So essentially there are several counties which are not managing their health properly. But on the other hand also, we must also try to look at the notion of rising extremism by trade unions from where I see it. I say that because I know trade unions, the way they evolved historically, they were supposed to protect the workers against exploitation by private capital. So you find trade unionism were entities that were fighting against oppression of the worker by what we call the capitalist entity. So, but then again, they found themselves into what we call the public sector, which ideally is a misnomer to the extent that the so-called socialist countries were state-driven. They were about public. So therefore, ideally, the best case scenario would be strong trade unions in private sector, not trade unions which the effect is you draw money from the taxpayers, you give it to some individuals, and the question then arises, is that a proper way of managing society? Remember, you have other things that you have to pay as a government. You have to pay, let's say, if at all is like education, you have to pay for capitation for fees. You have to think about school feeding programs. What about constructing classes? But then again, you see, at times, because of these strikes, you are compelled to stop doing that, to just pay, to have a ballooning wage bill. But on the other hand, I think it is wrong on the part of the counties. And the counties are doing very wrong to sign an agreement and then you renege on that agreement. The question is, why did you have to sign on that agreement?
They shouldn't have signed it.
That is wrong. If you sign,
it's deceptive.
Pay.
All right. Okay, and well, let's move on now to the Daily Nation and matters. Well, power firm caught in 14 billion land scam. And detectives are suspecting that officials at Ketraco inflated prices together with landowners, and that is for the construction of a power line between Mombasa and Nairobi. James Mamboleo, is there a week that we can have corruption not appear on our dailies in one way or the other? Here we're talking about 14 billion Kenyan shillings. And the unique angle to this, if what the detectives suspect is anything to go by, is the fact that this was not just Ketraco that are involved in this. They may have colluded with landowners. That, of course, would put us in a place where we are left wondering who will help Kenyans.
You see, Michael, Kenyans suffer corruption in all forms. And I think on this particular one, I really laud the president because he's trying to do something. However, the corruption that you see in this country is extremely sophisticated. Let me tell you what happens, for instance, in relation to a power line like this one. You know, the power line from Mombasa to Nairobi goes through a piece of land, a piece of highway that we call a wayleaf, okay? Sometimes when this power line is constructed, we have to reclaim land from private landowners. And so some compensation is given to those who have ceded a piece of their land for the construction of this particular power line. Now, what would happen is that where a piece of land that you have ceded would cost, let's say, 20,000 shillings in some village somewhere, the landowners will collude with the payers of that compensation, and you will find that probably that piece of land was paid for by about 500,000 shillings, 600,000 shillings. That is number one. Then number two, you have the contractor themselves that are building the power line. They could have inflated the construction of the power line by several billions of shillings. So the question here is a question of the corruption that you have seen in government circles, especially in parastatals. And I think this is one of those things for which every Kenyan should rise up on a daily basis, because we are not going to hear any of these, we are not going to hear the last of these anytime soon. And this requires continuous and consistent fighting, both by the agencies which have been designated to fight corruption, like the EACC and the DCI, and the Director of Public Prosecutions, taking these people to court on a daily basis and charging them. And then ultimately the courts expediting those cases and make sure those who are supposed to go to jail or fined, especially to jail, actually go to jail. And I think this is one of those things for which we should be very clear. We are not calling for this messenger in the parastatal that we call Ketraco. We want these guys to go for the directors. They want the DCI to go for the CEO. If this is the guy who is...
Evidently, if there's collusion between the landowners and Ketraco, then of course it is something that those at the top helm would be aware.
Absolutely. We want to go for the big fellows. We are tired of the DCI coming to court with, let's say, or the DPP coming to court with 50 names. We don't want 50 names. We want 4, 3 or 5 names of the top management. Bring the board, make the courtroom their daily boardroom, so that these people can understand that this is public money that is at stake. And most importantly, we want to encourage a system in which when people seek office, public office, you want to become a CEO of Ketraco, you are looking for that job to serve Kenyans, not to enrich yourself in the shortest time possible, like it happens with most parastatals in government.
All right, and of course the subject here is corruption, which is something that we are going to look at as we look at the topic that we're going to handle this morning on The Way It Is. For now, we're going to take a short break, but just a quick reminder of the question that we're asking is, are you satisfied with the government's progress in achieving the Big Four agenda? So far, 17% of you say yes, and a huge majority of 83% say a big no. So what is your take? Are you satisfied with the government's progress in achieving the Big Four agenda? That's where we're going to start our conversation on The Way It Is, and that is just putting the government in check in terms of their promise to deliver the Big Four agenda. Remember, we have seen the president basically come out very tough, very strong, and even talk to the CSs as late as last week, telling them that if you are found involved in matters politics, then you might as well just hand in your towel, throw in your towel and quit. We'll be looking at that as we come back. So for now, we take a break. We'll be right back.